Functional Physio presents ePoster 2020. Associated by Mind Academy and Sportson.
Presenter Shan Magapriyan S. On title Physiotherapy Management for COVID-19 Acute Care in Hospital Setting.
Good morning to one and all present here. This is Shanmuga Priyan, physiotherapist. Today my topic is physiotherapy management for COVID-19 acute care in hospital setting. We know that overall the world is affected through this COVID-19. This is the severe acute respiratory syndrome coronavirus 2. SARS-CoV-2 is new coronavirus that emerged in 2019, that is COVID-19. It can be transmit from through droplets or infection from person to person. The incubation period for this virus is 2 to 10 days. After that only the person will get the start of their symptoms. This virus can transfer through hand contacts, by touching, and through nose, mouth, eyes, etc. Our main scope of this presentation is, review is how the physiotherapy are taking care in the acute stage in the hospital setting. So in this, the many primary health care facilities are playing a main role in the management of the patients admitted in the hospital with confirm of COVID-19. Our physiotherapy management, our physiotherapists have the main role mainly in the respiratory point of view, that is cardio point of view, because this virus is mostly affected in the lungs. So due to that, the person have a difficulty in the breathing, etc. So most of the persons are when they have severe symptoms, they will be shifted to ICU with ventilation support. The airway clearance technique will be took by the therapist. Positioning, etc. will be took by the physiotherapist. Our main recommendation about this plan is, we will use personal protective equipments, and we will do the therapy like for respiratory and mobilization also. While adapting these recommendations, the scope practice within the local tech context should be considered also. Like we will plan and we will prepare some work. We will increase the physiotherapy workforce for additional shifts because everyone cannot enter the ICU frequently from outside. So we will divide the teams, and we will change the work shift. Then a specialized knowledge skilled person we will describe with with the ICU staffs and allied doctors and the chief physiotherapist who is in the ICU. Then we will advise the ICU physiotherapist should be supported by screening every patient with COVID-19 assessment to confirm that if they are affected or not. Then after that, we will suggest to have the staff to judge if they are having a COVID-19. We will make the patients in isolation ward or COVID-19 ward, or else we will make it in normal ICU, because this virus will get spread for all of the patient who are nearby or doctors, therapists, whoever. So to avoid the spreading, we will take care. We physio will first focus to give the treatment for the respiratory infected person who will have a dry or non-productive cough. Then we staff should not we won't routinely enter the isolation room, because when the patient got confirmed as suspect for COVID-19, we won't make a routine entering of that ward due to some precaution of virus. Then we recommend all our teammates to use that PEP equipments, like personal protective equipment. For respiratory care, we have some principle like airway clearance techniques for non-invasive ventilation and respiratory positive pressure breathing, and we will give some techniques to facilitate the secretion to clearance and to have a clear chest. Then we will have in the early stage, we will do the mobilization for the person, because if the person is bedridden, they have some more complication. If they are not in the early stage, the person can able to do all their works approximately. So with the support of physio, we will encourage them to do their work individually or with minimum support, because whenever the activity increase, the person may get good development. Starting, we will encourage to do the early mobilization exercise. Then we ask to the patient to perform some simple exercise in the bed and out of bed. Then we will prescribe some exercise and mobilization with the support. Then after that, the patient will when the patient will get developed, we will ask the patient to do individually the exercise, and we won't use large equipments for this kind of patients, because already due to their health issues, they have a lot of stent deficiency. So due to that, we physio will focus on their respiratory, lungs, and their strengthening. So mainly we focus for all the breathing exercise, positioning. We ask the patient to avoid collection of secretions to stay inside the lung. Whenever they cough, try to cough with the sputum. Then try to take it out all the sputum whenever they have a chance. So we will encourage them to do that. Mainly we may try to maintain our airway and lungs always clear as much as possible. So these are the works mainly we will do for the physio in the acute stage in the hospital setting. So this is my review of this journal. The reference has been displayed in the poster. Some of them are most of them I took it from the journals, and some from web source. So this is the thing. Thank you.